Hello and welcome to another Health Essentials podcast. I'm John Horton, your host. Odds are you don't think about your kidneys all too often, and that's pretty understandable. They're not exactly an attention-seeking organ, but your kidneys are essential for your survival. And for many folks, they're not doing so hot. It's estimated that 1 in 7 people have chronic kidney disease, meaning their kidneys are beginning to lose function. Today, we're going to talk with urologist Jorge Gutierrez about ways to keep your kidneys healthy. He's one of the many experts at Cleveland Clinic who visit our weekly podcast to broaden our understanding of our bodies. So with that in mind, let's find out why our kidneys deserve a little TLC. Welcome back to the podcast, Dr. Gutierrez. It's always nice to see a familiar face.
Thank you so much. Very happy to be here again with you, John, and very happy to share with the audience some recommendations.
You have great advice. And you're here to talk about kidneys. That's kind of your specialty here. But when it comes to kidneys, it seems that many of us don't really know what we've got inside of us. I found one survey showing that 80% of people didn't know the primary function of their kidneys or where they're located. And I love this one. 25% of people thought they could live without their kidneys. So I'm assuming in your job, you have to do a lot of explaining to folks about what's going on with the kidney.
Yeah, totally right. So the first thing is, it seems that a silly thing, but it's important. Kidneys are in the back part of the body. They are located in a cavity that we call retroperitoneum, that is really the posterior part of the front abdomen where all the bowels live. And the reason why it's important to say this is because main issues coming from the kidney start in the back part of your body. Example, a stone that blocks the drainage of urine, pain is going to start in the back part of your body. But let me explain you the renal function. What is the kidney? What does the kidney does? The kidney is a filter. The kidney is going to filter everything that we have in the blood that we don't need it. And the filter works so perfectly that it will, in the internal structure of the kidney, it will separate the good things from the bad things in blood. So those bad things that we can call waste product, that can be some salts and minerals and some other waste things, and the excess of liquid that we don't need inside the body, it's going to be filtered by the kidney and it's going to be excreted. Now, this liquid is going to call urine, and urine is full with all these waste products. So a good renal function will keep whatever we need inside in the blood and will excrete whatever we don't need inside in the blood.
Yeah, it's kind of like the cleaning mechanism for your whole body. It's kind of scrubbing everything down.
That is a filter. It's exactly this. This is exactly this. And this is why when somebody has renal dysfunction, renal failure, so the kidneys are not working well, this is the reason why these waste products are not eliminated from the body, and that's when they start getting toxic inside the body. Yeah. And this is the main concern, of course, of the renal dysfunction. The filter that we were saying, this cleaning mechanism that we have, that is are the kidneys, is not working well. So a lot of the bad things in the blood will remain inside the body.
Yeah. Well, you can see just by hearing that, you can see why it's so important to maintain kidney health. I mean, it's kind of like, reminds me if garbage picker or the people who collect garbage go on strike, it's a mess. You know what I mean? If nobody's picking it up, you got all this stuff accumulating. If your kidneys don't work, you're going to have that same thing. And just within your body, all this waste is going to build up, and that's just never going to be good.
That is exactly the best analogy that you can say. Yeah, imagine that in your house, you just keep the waste for 1 week to the next week to the next week, and at some point, it's going to be fun. So this is exactly what happened. But unfortunately, worse that it gets renal function, it's going to be more difficult to clean all this, this garbage or this waste product that have been accumulating there in the blood.
Yeah. And it's amazing just how much your kidney does. I wrote down the one stat, and I want to make sure I look at it. I saw that the kidneys process 200 quarts of fluid every day, which is enough to fill a large bathtub. That's a lot of work.
Yeah, that's the amount of, the filtration, if you will, of the kidney. Yeah.
Wow.
Just to follow with this, what happened when the kidneys start failing, when the kidneys start working bad? It's going to start uh, coming to a point where symptoms begin. And because at the beginning, there are no symptoms. The kidneys start having issues working, and we don't notice that, or we don't know that unless we do some sort of blood test and find out that the kidney is not working or start working and properly. But the bottom or the important thing is to let people know that whenever the renal dysfunction has progressed to a point that the kidneys cannot clean anymore the blood, there's no other way than to do an artificial cleaning of the blood, which is called dialysis, or transplant, receive another kidney. So it is important because this is unless there's an acute issue that mostly ever the acute issue is resolved, a chronic kidney disease is going to progress to the point that there's not going to be any chance to help the kidney anymore, but doing an artificial cleaning of the blood with the dialysis.
Are there any early signs that somebody might be able to pick up on that their kidneys are starting to have a little trouble?
Again, the symptoms at the beginning are very infrequent. I will say that the initial symptoms that may be already when you have what we call intermediate kidney failure, maybe dizziness, maybe headache, maybe a lack of appetite, so people don't want to eat, maybe problems sleeping, and some other things like hypertension and basically these are the most frequent symptoms. And also people may start noticing that they are not producing the same amount of urine, so they are voiding less liquid, less urine than in the past. And those are symptoms, again, that unfortunately don't happen early when the conditions start. But there are things that people can anticipate in order to prevent this.
We're going to get into the tips here. All right, I like that because it sounds like you really want to make sure you keep those kidneys humming along and working their best. So lay out what we can do to make sure everything's working properly.
Exactly. There are risk factors that will favor the renal dysfunction, and the main two are hypertension or diabetes. So everybody who has hypertension or diabetes, they need to be sure that they have a good control. You may have hypertension and you think that you're taking the correct medication, but if you're not checking the pressure frequently, that means that the kidney is going to be suffering without notice. Diabetes is the same, probably even worse, because people may be taking a medication, but whenever they do the blood test, and maybe not very frequent at the beginning of the diabetes, for example, then the kidney have suffer consequences of that.
Yeah, I was going to say, so those two, control your blood pressure and keep your blood sugar in check would Correct. Be two key things.
Correct. Especially for for those people who already know that they have this condition, hypertension and diabetes. So bottom line is they need to do a close follow-up on these two conditions, otherwise they will increase the risk of renal dysfunction. Some of the things that I think are very important people to understand is we find now a lot of things on the counter that people can take for pain control or some other things. Medications are a high risk factor for renal damage, or for renal dysfunction, especially pain medication in the long term, anti-inflammatory medication in the long term, and some other medications. But I think people should not be receiving a lot of auto prescriptions, and better look for medical care in case that they have some chronic condition. For example, somebody has chronic pain, and for some people it's easy just to go to the counter and buy something that relieve the pain. Not a good idea. I think it's better to understand where the pain is coming from and how the pain can be treated.
Yeah, you always hear that, and that's one of those things I don't think a lot of us realize. I guess the potency of some of those pain medications that you take. And if you take them regularly over and over and over again, it sounds like you can do some damage to your kidney over time.
Yeah, sure, you do. Some other two frequent conditions that people don't realize that are risk factor for renal dysfunction are smoking and drinking alcohol. So smoking and drinking alcohol, again, in the long term, will have a risk for renal dysfunction. But now, the most important thing to understand is it's a sum of all these factors. Somebody who smokes is going to be somebody who drinks alcohol, and in addition to that has hypertension and start having diabetes, and so on and so on. So all these factors together are going to increase the risk of renal dysfunction for sure.
And then I think you had mentioned earlier too, we had talked about hydration. It's something that sounds like your kidneys really need. You got to have fluid going through and make sure you're getting enough water in.
Correct. We were discussing that if you get hydrated, what it's going to do, you're going to help washing out or eliminating all the salts and minerals that the kidneys is creating. And these salts and minerals, I mean, we discussed that they may be the basis of the formation of a stone, but also they may collect or get stuck in a part of the internal tissue of the kidney that will affect in the long term the renal function. So yes, hydration is always recommended. If somebody has already a renal dysfunction, maybe that the hydration or the amount of liquids need to be adjusted. But in order to prevent renal dysfunction, yes, it's always good to get hydrated, to get physical activity, and physical activity with good hydration after that physical activity. I have a healthy diet, a healthy diet. If you eat a lot of meat, a lot of animal protein, and you eat some things that are at the end, risk for damage to the renal function. Again, I think the most important thing is to consider that there are different factors, but at the end, it's a summatory of all these factors. It's not only a single factor in anybody.
Yeah, it sounds like a lot of it goes to overall healthy living and just everything that you brought up. Hydration, healthy diet, keeping your blood sugar in check, your blood pressure in check, maintaining a healthy weight, exercising, and then limiting alcohol and smoking. I mean, those are just good overall health tips.
That's right. That is right. Yeah.
It is amazing. We talked about how kidney function is so important and how so many people don't even realize that they have issues. And I know I was really shocked to read that chronic kidney disease causes more deaths each year than breast cancer or prostate cancer. And that was from the National Kidney Foundation. I don't think a lot of people realize that. It seems like this is a kind of an under-recognized public health crisis.
That is totally right. And if you see also the data coming from all the different institutions in this country, you're going to see that there's an increase in the number of kidney transplant all over the place. And the reason of the kidney transplant is that we have, unfortunately, more and more people with some renal dysfunction. And I was saying earlier that before the kidney transplant, people need to have assistance of this artificial machine that wash the kidneys, or that made the function that the kidney cannot do and wash the blood, which is called dialysis. But the dialysis in the long term is not going to be possible for everyone, or is going to, has a limited lifetime, maybe. Well, so the amount of kidney transplant need for new kidneys is increasing all over the place, and the reason why is because, unfortunately, there are more and more people with renal dysfunction.
So you laid out kind of this guidance, this advice on things we can do to kind of help our kidneys stay healthy. If you do that, I mean, how likely are you to prevent kidney issues? I mean, do we really have that much control over what happens?
I think that's a very important question, because there may be some other genetic factors or some other factors that can still increase the risk of renal dysfunction. But again, as I was saying before, as this is a summatory of factors, if you can decrease the risk factors that are on your hand, like diet and smoking and alcohol intake, and all these things that you can prevent, at least you can decrease the overall risk of having a renal dysfunction at some point. There may be some other factors that probably don't even understand very clear, like genetic factors or some other conditions that at the end they're going to drive to renal dysfunction. But what is in the hands or in the capacity of the people to prevent, like the things that we are discussing, but then there's always a good recommendation to start there.
Yeah, you can just improve your odds, it sounds like, if you
That's
make
it.
these sort of healthy changes.
Yeah.
Well, Dr. Gutierrez, I got to say, we talked at the start about how people knew very little about their kidneys. If they've listened to this whole podcast, I hope they're part of that future survey, because the scores are going to look a little better given all the information that you've shared.
But I think it's a great what you're doing, because, yeah, I mean, there's no other way than just promote more information to the patient and say there are simple things that they can do in order to improve their general health. And risk factors that we were saying: diabetes, hypertension, obesity. Of course, obesity is a big risk factor. So people need to understand that the consequences of these conditions, of these diseases, sooner or later, is going to be renal dysfunction. So they need to be aware of all these things, and hopefully they can help the health of their kidneys.
I can't think of a better way to end than with that statement. So once again, I appreciate your time and you coming in to share so much information with us. And I look forward to having you back on.
Very happy to do it. Thank you so much.
You need your kidneys to live, and your kidneys need your help to be at their best. Take care of them by drinking enough water, eating a healthy diet, and controlling your blood pressure, blood sugar, and weight. They'll thank you for it. If you liked what you heard today, please hit the subscribe button and leave a comment to share your thoughts. Till next time, be well.